This is the video guidance for double pumping the same strength noradrenaline. This video has been made to use in conjunction with our new SOP for double pumping released April 2024. Here we are shown a single strength noradrenaline infusion with 2 hours left and 10 ml left in the syringe. The SOP stipulates the infusion should be changed 1 hour prior to the end of infusion or a minimum of 10 ml left in the syringe, whichever comes first. In our blue ANTT tray, we have our new 4 mg noradrenaline infusion with a new line attached and noradrenaline labels at the syringe and patient end of the line. The line has also been primed. As NORAD is not stable for longer than 24 hours, please ensure you prime a new line with every new syringe as per SOP. We will set our new infusion up in our second designated noradrenaline pump, which should be directly above or below your current infusion. Once inserted into the pump, select New Infusion, and this will give you the option to mandatory set prime. Prime the line until you can see drops coming out of the end of the infusion. As we have not yet double pumped, this lumen will still be free. This is where we will attach our new infusion. Prior to connecting, ensure you clean the hub for 15 seconds and leave to dry for 30 seconds. Once connected, unclamp the line. Ensure all the other lines are unclamped and follow your line back. Ensure the clamp nearest the syringe is also unclamped before setting the rate. As we are double pumping the same strength of 4 mg, we will be going for the same rate, which is 5 ml an hour. As we have connected our new 4 mg noradrenaline infusion to an octopus lumen already primed with the same strength, it should not take long before we see a response in the patient's blood pressure. The SOP states we should see a rise in 10 mm of mercury in the systolic blood pressure before you halve the rate of the old noradrenaline infusion. Here we will reduce the infusion to 2.5. As we are double pumping, we will not be stepping away from our patient whilst we monitor the blood pressure. Once you reduce the rate and you continue to see a rise in the blood pressure, we will continue to halve the rate of the old infusion. Our blood pressure continues to rise, so we will continue to halve the rate of our old infusion until we manage to turn it off. Once we have managed to wean down the old noradrenaline infusion, the lowest rate we can go to is 0.1. Stop your infusion. Follow the line back to the octopus port no longer in use and clamp the line. You will also need to engage the clamp nearest the syringe. Follow the line back down towards your syringe to ensure you employ the correct clamp. Turn off your infusion and leave the syringe and the line connected to the octopus. The 10 ml left in this old syringe can be used as the backup pump. When double pumping, your lines should always be left like this. You should never have a vacant port unless you have just set up the infusion. This is a safety feature to stop any boluses being given down the spare lumen.